Many people underestimate the importance of proper sleeping positions, especially as they age. For the elderly, sleep isn't just about rest. It plays a crucial role in overall health. The wrong position can negatively impact blood circulation and brain function. In some cases, it can even increase the risk of a sudden stroke. Understanding which positions are harmful is essential for prevention. One of the most dangerous sleeping positions for older adults is lying flat on the back with the head too low. This posture may cause blood to pool in the brain or neck area, especially in individuals with high blood pressure. Over time, it may place added stress on the blood vessels. If those vessels are already weakened, the strain can lead to rupture. That's when a stroke can happen suddenly and without warning. Side sleeping is often recommended, but not all side positions are created equal. Sleeping on the right side is generally better for heart health and circulation. However, sleeping on the left side for extended periods may compress the heart and increase pressure on vital organs. In older adults with pre-existing conditions, this can further complicate blood flow. It's crucial to balance comfort with safety when choosing a sleep posture. Another overlooked factor is the use of pillows. Pillows that are too high or too flat can misalign the neck and spine, disrupting blood flow to the brain. This misalignment can be especially risky for elderly individuals with existing cervical or spinal issues. A poorly supported neck can constrict arteries or trigger clot formation. Investing in ergonomic pillows can significantly reduce these risks. Sleep apnea, which is common in seniors, can also be worsened by certain positions. For example, sleeping on the back may cause the tongue and soft tissues to obstruct the airway. This leads to repeated drops in oxygen levels during the night. Over time, this can damage blood vessels and increase the likelihood of stroke. Managing sleep apnea through proper positioning and medical treatment is vital. Circulation naturally slows with age, making posture during sleep even more important. Positions that compress limbs or restrict blood flow can cause clotting. A clot that travels to the brain can result in an ischemic stroke. Avoiding positions that place pressure on the arms or legs, like curling too tightly or crossing limbs, can reduce this risk. Light stretching before bed can also improve circulation. Dehydration is another hidden contributor to nighttime stroke risk. Seniors often drink less water to avoid nighttime urination, but this can thicken the blood. Thickened blood has a higher chance of clotting, especially when the body is inactive during sleep. If combined with a poor sleeping position, this can be a dangerous mix. Staying moderately hydrated before bed can help without disrupting sleep too much. Caregivers and family members should be proactive in discussing sleep hygiene with elderly loved ones. Simple changes like adjusting pillow height or body orientation can make a big difference. Encouraging routine sleep schedules and monitoring nighttime behaviors can also help detect issues early. Many seniors don't realize that how they sleep is just as important as how much they sleep. Education and support are key to prevention. Healthcare providers often focus on diet and exercise, but sleep position is rarely discussed during routine checkups. Yet, it can be a silent contributor to major health events like stroke. Seniors should feel empowered to ask their doctors about safe sleep practices. A personalized approach based on medical history and physical condition is ideal. Sleep, after all, should be a time of healing, not harm. In conclusion, the way elderly individuals sleep has a direct impact on their stroke risk. Small changes in sleep posture, pillow use, and hydration can go a long way in prevention. By spreading awareness, we can help seniors rest more safely and peacefully. Sleep should restore the body, not put in danger. Knowing the risks is the first step toward a healthier night's rest. Not all elderly individuals are aware that body posture during sleep can impact intracranial pressure. Certain positions may cause cerebrospinal fluid or blood to shift in ways that increase pressure within the skull. This is especially risky for those with a history of mini strokes or transient ischemic attacks, TIAs. Even brief spikes in pressure can cause damage over time. Monitoring for symptoms like dizziness or morning headaches may help detect subtle warnings. The quality of the mattress also plays a role in maintaining a safe sleeping posture. A mattress that is too soft may cause the body to sink and twist unnaturally, leading to poor spinal alignment. Conversely, a mattress that is too firm might create pressure points that disrupt circulation. Seniors often benefit from medium firm memory foam or orthopedic mattresses. The goal is to support the body evenly without excessive pressure on any one area. Temperature and room environment can also influence sleep position and movement during the night. If the room is too cold, seniors may curl tightly or shift into restricted position for warmth. These positions can impede circulation and put pressure on blood vessels. Using adequate bedding and maintaining a stable room temperature can prevent these unconscious adjustments. A consistent sleep environment encourages more natural, relaxed positions. Frequent nighttime waking can also lead to poor repositioning. When elderly individuals wake up disoriented, they might return to sleep in awkward or strained postures. Over time, this can become habitual, further increasing health risks. Encouraging routines that promote deep, uninterrupted sleep can reduce this issue. Techniques like calming bedtime rituals, limiting screen time, and avoiding stimulants can be helpful. Medication is another factor often overlooked in discussions about sleep posture and stroke risk. Some medications cause drowsiness or muscle relaxation, making it harder for seniors to control their positioning during sleep. Others may affect blood pressure or hydration levels, indirectly influencing stroke risk. It's important for patients to discuss potential side effects with their doctors. Adjusting medication timing or dosage may improve nighttime safety. Chronic pain conditions also contribute to poor sleep posture. Seniors dealing with arthritis, back pain, or hip discomfort may adopt unnatural positions to relieve pain. While this may offer short-term comfort, it can increase long-term health risks, including stroke. Working with a physical therapist to find safe and comfortable sleeping positions can make a big difference. Pain management strategies should always include consideration of sleep habits. Some elderly individuals experience reduced mobility, which makes repositioning during sleep more difficult. Limited ability to move may cause them to stay in one position for too long, which can restrict blood flow. Using specialized bed supports, such as wedges or adjustable beds, can aid in safer positioning. These tools not only provide comfort, but also reduce pressure-related health risks. Families and caregivers should consider these options as part of a holistic care plan. Monitoring devices are now available that track sleep patterns and body positioning throughout the night. These wearable or bed-integrated technologies can alert users or caregivers if unsafe positions are detected. While not a replacement for medical advice, they offer an extra layer of safety. For elderly individuals at high risk of stroke, this technology can provide peace of mind. Many of these devices are user-friendly and designed with seniors in mind. Education remains the foundation of prevention. Many elderly people grew up in times when sleep science was not well understood and outdated habits persist. Providing simple, easy-to-understand information through community centers, clinics, or even family discussions can have a powerful impact. When seniors understand why certain sleep positions are dangerous, they're more likely to make adjustments. Empowerment through knowledge is always the first line of defense. Finally, stroke prevention should always be approached as a comprehensive strategy. Sleep posture is just one piece of the puzzle, but an important one. When combined with healthy eating, exercise, stress management, and regular checkups, the risk of stroke can be significantly lowered. No single change is a cure-all, but together, these habits create a safer and healthier aging process. It's never too late to improve sleep and protect the brain. Cultural habits around sleep can also influence posture and stroke risk in the elderly. In some cultures, it's common to sleep on hard surfaces or without pillows, which can lead to spinal misalignment in older adults. Others may use very high pillows, believing they prevent snoring, when in fact they can obstruct circulation. These traditional habits, while once harmless, can become dangerous as the body ages. Re-examining these practices through a health lens is crucial for elderly well-being. Sleep position may also interact with other neurological conditions that are more prevalent in the elderly. For instance, those with Parkinson's disease or Alzheimer's may unconsciously sleep in rigid or contorted positions. These positions can interfere with circulation and muscle relaxation, raising stroke risk. Caregivers must be attentive not only to symptoms during the day, but also to sleeping patterns. Gentle repositioning techniques or soft restraints can help ensure safer sleep. Nighttime blood pressure fluctuations are another factor that can turn a poor sleeping position into a stroke trigger. During sleep, blood pressure naturally dips, but for some seniors, it may drop too low or spike unexpectedly. An awkward sleep posture can interfere with the body's ability to regulate this. Combined with arterial stiffness or plaque buildup, a stroke can occur silently during the night. Tracking nighttime blood pressure may help in high-risk individuals. Some seniors live alone, which makes it harder to identify dangerous sleeping habits. Without someone to observe snoring, sleep apnea episodes, or awkward positions, warning signs may go unnoticed. Encouraging regular check-ins, even virtually, can help catch problems early. Using motion sensor cameras in the bedroom with consent is another helpful tool. Independence is important, but so is safety, especially during sleep. Many people don't realize that the brain remains active and vulnerable during rest. Poor sleeping positions can limit oxygen to certain parts of the brain, leading to silent mini-strokes. These may not be noticeable immediately, but can cause memory loss or motor issues over time. A senior might just wake up feeling foggy, without knowing a small stroke occurred. This is why consistent, quality sleep posture matters so much in old age. Positioning the head slightly elevated has been found helpful for circulation and breathing. This can reduce intracranial pressure and prevent airway obstruction. Using an adjustable bed or multiple pillows under the shoulders, not just the neck, can create this incline safely. It's important, however, not to raise the head too much, as it may curve the spine unnaturally. Finding the right angle is best done with medical guidance. Some sleep-related issues stem from anxiety or depression, which are common but often undiagnosed in the elderly. Mental health can lead to restless sleep, frequent position changes, or long hours in bed during the day. These patterns can create uneven pressure on blood vessels or contribute to clotting. Addressing emotional well-being often improves sleep quality and safety. Talking openly about sleep and mood should be a part of routine elder care. Hydration, as previously mentioned, affects blood thickness, but so does diet. A high sodium or high fat diet increases the chance of clogged arteries and hypertension. When paired with a poor sleep position, this creates a perfect storm for stroke risk. Nutritional counseling can complement sleep posture education. A healthy circulatory system supports safer, more restorative sleep. Another often forgotten detail is the role of bedding materials. Heavy blankets or tight sheets can restrict natural movement during the night. Seniors may feel trapped in one position and hesitate to adjust, even if uncomfortable. This lack of movement can cause blood to pool or pressure to build. Choosing light, breathable bedding can encourage healthier nighttime mobility. In the end, sleep safety for the elderly is not about fear. It's about empowerment. Knowing how sleep posture affects stroke risk gives seniors the tools to make positive changes. Whether living independently or with help, small adjustments can prevent major health events. Family members and caregivers should support this by fostering open, respectful conversations about sleep. Prevention is a team effort, and it starts with awareness. Mobility aids in the bedroom can play a critical role in promoting safe sleep positioning. Grab bars near the bed, adjustable frames, or bed rails can help seniors shift positions more safely and confidently. Without proper support, many elderly individuals hesitate to move once in bed, even if their position becomes uncomfortable or harmful. Fear of falling is a common concern that often leads to prolonged immobility during sleep. By creating a more supportive sleep environment, we can help reduce that risk. The natural aging process brings changes in muscle tone, flexibility, and joint stability, which all affect sleep posture. A position that was once comfortable in youth may now place unnecessary pressure on joints or blood vessels. Over time, weakened muscles may fail to support optimal spinal alignment, especially during long hours of sleep. This can compromise circulation, particularly to the brain and extremities. Recognizing these physiological shifts is essential in choosing age-appropriate sleeping positions. Environmental noise and light can indirectly influence sleep posture by interrupting sleep cycles. When sleep is frequently disturbed, Seniors may turn or twist suddenly in response to external stimuli. These abrupt movements can create strain on the neck or spine, especially if the bed or pillow is not supportive. Over time, this may increase the risk of vascular compression or nerve damage. Creating a dark, quiet, and calming sleep environment supports both posture and quality rest. Rehabilitation specialists and occupational therapists can offer valuable insights into safe sleep strategies. These professionals can assess an elderly person's movement habits and suggest custom solutions to improve nighttime safety. Sometimes, a simple change in bed height or sleeping angle can prevent poor positioning. Involving specialists also helps seniors feel supported and empowered rather than restricted. Therapy-based interventions are often overlooked but can be highly effective. Sleep studies are another useful tool for understanding individual stroke risk during sleep. These studies monitor everything from oxygen levels to movement and heart rate, helping to identify dangerous patterns. In some cases, they reveal that certain sleep positions are worsening underlying health conditions. The insights gained can lead to targeted changes in sleep habits and posture. For elderly individuals with complex medical histories, this can be life-saving. Care homes and assisted living facilities should also be educated about the risks associated with poor sleep posture. Staff members play a key role in positioning residents safely and checking for signs of discomfort during the night. Training programs can teach them how to recognize risky positions and gently assist in repositioning when needed. Even small efforts, like encouraging a side-lying posture or adjusting pillows, can make a big difference. Institutional support is a powerful force in stroke prevention. Another valuable technique is the use of sleep tracking journals. Seniors or their caregivers can record sleep positions, comfort levels, and morning symptoms to identify trends. Over time, patterns may emerge that suggest a link between position and health outcomes. For example, waking up with numbness on one side or a stiff neck may signal that changes are needed. These observations can guide both self-care and medical consultations. Foot elevation is sometimes recommended for circulation, but it must be used cautiously. Elevating the legs too high without supporting the lower back can cause a backward tilt in the pelvis, disturbing spinal alignment. This may put pressure on the neck and increase intracranial pressure during sleep. Seniors should be guided on how to elevate their legs properly if recommended by a physician. Proper use of cushions and wedges is essential to avoid unintended risks. The psychological comfort of sleep position should also be considered. Many people have a preferred way of sleeping that feels emotionally safe or familiar. However, when health is at stake, it may be necessary to modify these habits gently. Introducing changes gradually, like alternating sides or adjusting the pillow height, can ease the transition. Respecting both emotional comfort and physical safety creates better outcomes. Ultimately, personalized care is the most effective approach to minimizing stroke risk from sleep posture. What works for one person may not work for another due to differences in health history, mobility, and comfort. Medical professionals, caregivers, and the elderly themselves must work together to find the safest and most sustainable sleep habits. Open communication and ongoing adjustments are key to long-term success. A safer sleep posture can be one of the simplest yet most powerful tools in stroke prevention. Hormonal changes in older adults, such as decreased melatonin production, can affect sleep depth and duration. Lighter sleep increases movement throughout the night, making it more likely for a senior to shift into risky positions unconsciously. This restlessness may cause temporary compression of arteries or uneven breathing patterns. Sleep posture becomes even more important when sleep is fragmented and unstructured. Supporting hormone balance through routine and light exposure may indirectly encourage safer sleep behavior. For elderly individuals recovering from a stroke, sleeping position is even more critical. Post-stroke brains are more vulnerable to pressure, oxygen fluctuations, and circulation issues. Certain positions, especially those that compress the affected side of the body, can delay recovery or increase risk of a second stroke. Therapists often recommend side lying on the stronger side with proper limb support. These guidelines should be tailored individually and followed consistently during the recovery phase. Napping during the day is common among the elderly, but posture during naps is rarely considered. Many seniors nap while sitting in recliners or couches, often with poor neck support. This can result in temporary constriction of blood flow to the brain or upper spine. Although naps are beneficial, it's important to use proper cushions or reclining angles to avoid strain. A quick nap in a bad position may still contribute to cumulative vascular stress. Post-surgery recovery introduces additional sleep challenges for older adults. Limited mobility, pain, or medical devices like catheters can force them into awkward sleeping positions. These compromises may restrict circulation or aggravate pre-existing vascular conditions. Nurses and caregivers should help position the patient safely during this vulnerable period. Proper recovery isn't just about wound healing. It also involves protecting neurological health through smart positioning. In cases of obesity among elderly individuals, excess body weight can affect how pressure is distributed during sleep. Fat deposits around the neck and abdomen may worsen breathing patterns and contribute to sleep apnea. When lying in certain positions, the weight can also compress blood vessels more easily. Sleep posture in such cases must be carefully adapted to maintain both airway and blood flow integrity. Supportive bedding and positional aids become even more essential. People with diabetes also need to be extra careful about sleep posture due to increased stroke risk. Nerve damage, poor circulation, and blood sugar fluctuations during the night all play a role. If combined with a sleep position that restricts blood flow further, the danger grows. Elevating certain limbs or cushioning pressure points can help maintain healthy circulation. Diabetic patients should consult both doctors and sleep specialists to create a sleep-safe environment. Even dental or jaw alignment problems, such as TMJ, temporomandibular joint disorder, can influence safe sleeping posture. Improper jaw alignment during sleep may put strain on facial arteries or contribute to neck tension. In turn, this tension can affect blood flow to the brain, particularly in sensitive individuals. Using mouth guards or adjusting pillow support can alleviate this risk. Sleep position must support not just the spine, but also jaw and head posture. Community-based programs aimed at elderly wellness should include education about sleep posture and stroke prevention. Workshops, senior center talks, or pamphlets distributed at clinics can go a long way in raising awareness. Many seniors simply don't know the risks of poor posture during sleep and rely on outdated habits. By teaching this topic in a group setting, it can reduce fear and promote shared learning. Knowledge shared in community spaces is often more impactful than isolated advice. Technology continues to evolve to address health risks during sleep. Some new smart beds and mattress toppers automatically adjust based on body position and pressure points. These innovations may gently reposition an elderly sleeper throughout the night to prevent prolonged compression or misalignment. While still costly, such tools may become more accessible in the future for at-risk populations. They represent a merging of comfort and safety through engineering. In summary, the issue of sleep posture and stroke risk in the elderly is multifaceted and deeply personal. It intersects with medical history, physical condition, emotional comfort, and even financial access to proper bedding. There is no one-size-fits-all solution, but there are many small actions that together make a big difference. From education to equipment to daily routines, prevention is within reach. With increased awareness, the simple act of sleep can become a powerful shield against stroke. Many elderly individuals continue to use the same sleep habits they developed in their youth, unaware that their bodies have changed. A position that was once harmless at age may 30 have become dangerous by age 70 due to reduced circulation and stiffer arteries. The body's resilience declines with age, making poor posture more impactful during long sleep periods. Without conscious adjustment, these old habits can silently increase stroke risk. Routine reevaluation of sleep posture should be part of healthy aging. Physical activity during the day has a strong connection to sleep quality and posture at night. Seniors who exercise regularly often experience deeper, more restful sleep, reducing the chances of restless shifting into poor positions. Stronger muscles and joints also help maintain proper alignment during sleep. In contrast, sedentary lifestyles can lead to stiffness, making it harder to find a safe and comfortable sleep posture. A gentle evening stretch or walk can support safer rest. Some people naturally move frequently during sleep, cycling through several positions. While movement can reduce pressure buildup, it can also lead to moments of poor alignment. For elderly individuals, even a few minutes in a harmful position can be risky, especially if they have cardiovascular conditions. Sleep movement tracking can help reveal if a person often ends up in problematic positions. Knowing your natural sleep tendencies can guide pillow and mattress choices. Traveling across time zones or dealing with jet lag can disrupt sleep-wake cycles and position habits. Fatigue and disorientation often lead to falling asleep in awkward positions on planes, buses, or unfamiliar beds. Seniors are particularly vulnerable to this, as recovery from time zone shifts takes longer with age. Even short naps in cramped travel seats may reduce blood flow to the brain or limbs. Planning ahead with travel pillows or footrest can help maintain circulation. Chronic dehydration, common in older adults, makes blood more viscous, increasing the chance of clot formation during sleep. A poor sleeping position that further limits circulation can turn this into a dangerous combination. While hydration is often discussed during the day, nighttime blood fluidity is equally important. Seniors should be encouraged to drink enough water earlier in the day to stay hydrated without frequent night urination. Maintaining balanced hydration supports safer sleep. Weather and seasonal changes can influence sleep posture in subtle ways. In colder months, people often curl up tightly to stay warm, unknowingly restricting chest expansion and blood flow. In hot conditions, they may sprawl in positions that twist the spine or neck awkwardly. Seniors are especially sensitive to temperature discomfort and thus more prone to changing positions unconsciously. Using temperature-regulating bedding can support both comfort and proper alignment. Vision or balance issues may cause fear of falling when getting into or out of bed, leading seniors to freeze in the position they first lie in. This fear may prevent natural adjustments during sleep, increasing pressure buildup in vulnerable areas. Bedside lighting, secure railings, and orientation aids can reduce this anxiety. When seniors feel confident in their surroundings, they are more likely to shift safely throughout the night. Environmental reassurance supports better posture habits. Some elderly individuals experience vivid dreams or nightmares due to medications or neurological changes. These intense dreams may trigger sudden physical reactions, like jerking or curling tightly. Repeated episodes can strain neck muscles or briefly restrict blood flow to the brain. Monitoring medications and discussing side effects with a doctor can help manage these events. Sleep safety isn't just about stillness. It also involves controlling sudden, involuntary movements. Hearing loss can indirectly affect sleep posture as well. Seniors who can't hear environmental sounds may sleep more deeply in potentially dangerous positions without waking to discomfort. On the other hand, those who use hearing aids might remove them at night, missing auditory cues that could trigger position shifts. Sleep monitoring tools that use vibration or light instead of sound can assist in these cases. Customizing the environment to sensory needs enhances overnight safety. Finally, addressing sleep posture concerns should always be done with compassion and respect for autonomy. No elderly person wants to feel micromanaged in one of the most private aspects of life, how they sleep. Framing the conversation around empowerment, comfort, and long-term health makes it more acceptable. Simple aids like body pillows or gentle reminders can go a long way without making someone feel controlled. Dignity and health can and should go hand in hand in sleep care.